When we think about maintaining a healthy brain, we often focus on diet, exercise, and mental stimulation. However, there's a growing body of evidence suggesting that the health of our mouths, particularly our gums, plays a crucial role in protecting our cognitive function as well. This connection might seem surprising at first, but the reality is that our oral health and brain health are intricately intertwined. For many years, the medical community largely treated these areas as separate entities. However, recent scientific discoveries have illuminated a clear link between gum disease and an increased risk of cognitive decline, including serious conditions like Alzheimer's disease. Understanding this connection is paramount for anyone looking to safeguard their brain health as they age. This essay will delve into the fascinating relationship between oral health and brain health, exploring the mechanisms by which bacteria in our mouths can impact our cognitive function. We'll examine the latest scientific findings, discuss practical tips for maintaining optimal oral hygiene, and highlight the importance of a holistic approach to health and well-being. Our mouths are teeming with bacteria, both beneficial and harmful. While a healthy balance of oral bacteria is essential for good digestion and overall health, an overgrowth of harmful bacteria can lead to gum disease, also known as periodontal disease. Gum disease is a chronic inflammatory condition that affects the tissues surrounding and supporting our teeth. You might be wondering how bacteria from our mouths can possibly reach our brains. The answer lies in the anatomy of our head and neck. Blood vessels in our gums provide a direct pathway to the brain, and when gum disease sets in, these blood vessels become inflamed and more permeable. This inflammation allows harmful bacteria and their toxins to enter the bloodstream and travel to various parts of the body, including the brain. Once these bacteria reach the brain, they can trigger a cascade of inflammatory responses, leading to damage of brain cells and potentially contributing to cognitive decline. It's a bit like a domino effect where poor oral health sets off a chain reaction that ultimately impacts the health of our brains. Alzheimer's disease is a devastating neurodegenerative disorder that leads to memory loss, cognitive impairment, and ultimately, dementia. While the exact causes of Alzheimer's are still being investigated, a growing body of research suggests a strong link between gum disease and an increased risk of developing this debilitating condition. One particular bacterium, which is commonly found in the mouths of people with gum disease, has been identified in the brains of Alzheimer's patients. This bacterium is known to produce toxins called gingivalis, which have been shown to damage neurons, the cells responsible for transmitting information in the brain. Studies have also found that the presence of in the brain is associated with higher levels of amyloid plaques and tau tangles, the hallmark brain lesions found in Alzheimer's disease. These findings have led scientists to believe that and its toxins may play a significant role in the development and progression of Alzheimer's disease. This discovery has opened up new avenues for research and potential treatments for this devastating condition. The brain is normally protected from harmful substances by a specialized barrier called the blood-brain barrier. This barrier acts like a gatekeeper, carefully regulating what can enter and exit the brain. However, inflammation caused by gum disease can weaken the blood-brain barrier, making it easier for bacteria and their toxins to slip through. Once inside the brain, these foreign invaders trigger an immune response. The body's natural defense mechanisms spring into action, trying to neutralize the threat. However, this immune response can sometimes cause more harm than good. The prolonged inflammation that often accompanies chronic gum disease can lead to the release of inflammatory chemicals called cytokines. These cytokines, while intended to fight infection, can damage healthy brain cells and disrupt the delicate balance of the brain's environment. Over time, this chronic inflammation can contribute to neurodegeneration, leading to cognitive decline and potentially increasing the risk of developing neurodegenerative diseases like Alzheimer's. As we age, our oral health naturally declines. Our gums may recede, making our teeth more vulnerable to decay and infection. We may also produce less saliva, which helps to wash away food particles and harmful bacteria. These age-related changes can increase our risk of developing gum disease. Tooth loss, a common consequence of untreated gum disease, can also impact our cognitive function. When we lose teeth, we lose stimulation to the jawbone, which can lead to bone loss in the jaw. This bone loss can affect the shape of our face and make it difficult to wear dentures comfortably. More importantly, tooth loss can also impact our ability to chew food properly, leading to dietary changes and potentially nutritional deficiencies. These factors can indirectly contribute to cognitive decline by affecting overall health and well-being. For example, nutritional deficiencies have been linked to cognitive impairment, and difficulty chewing can lead to social isolation and decreased quality of life, both of which can negatively impact brain health. The good news is that gum disease is largely preventable. By adopting simple yet effective oral hygiene practices, we can significantly reduce our risk of developing this condition and protect our brains in the process. Here are some practical tips to maintain optimal oral health. Brush your teeth at least twice a day for 2 minutes each time using fluoride toothpaste. Make sure to use a soft bristled brush and gentle circular motions to avoid damaging your gums. Flossing once a day is crucial for removing food particles and plaque from between your teeth, where your toothbrush can't reach. Consider using interdental brushes if you find traditional floss difficult to use. Limit sugary drinks and processed foods, which can contribute to tooth decay and gum inflammation. Focus on consuming a balanced diet rich in fruits, vegetables, whole grains, and lean protein. Drinking plenty of water throughout the day helps to wash away food particles and bacteria, promoting saliva production and maintaining a healthy oral environment. Schedule regular dental checkups and cleanings at least every 6 months to catch any potential problems early on and receive professional cleaning and guidance. By incorporating these simple yet powerful habits into our daily routines, we can take proactive steps to maintain optimal oral health and protect our brains from the harmful effects of gum disease. Remember, a healthy mouth contributes to a healthy body and a healthy mind. The discovery of the link between oral health and brain health has opened up exciting new avenues for research and potential treatments for neurodegenerative diseases. Scientists are currently exploring a variety of approaches, including researchers are working on developing vaccines that could target the harmful bacteria responsible for gum disease, preventing the inflammation and damage they can cause. Existing anti-inflammatory medications are being investigated for their potential to reduce inflammation in the brain caused by gum disease. Studies are underway to determine if specific probiotics, which introduce beneficial bacteria to the mouth, or prebiotics, which feed the good bacteria already present, can help improve oral health and reduce the risk of cognitive decline. Researchers are developing new diagnostic tools to detect gum disease and cognitive decline at earlier stages, when interventions are likely to be most effective. These are just a few examples of the exciting research currently underway. While more research is needed, these investigations offer hope for new and innovative ways to prevent, treat, and potentially even reverse cognitive decline associated with gum disease. Maintaining good oral health shouldn't be viewed as a separate entity, but rather as an integral part of a holistic approach to overall health and well-being. Just as we prioritize a balanced diet, regular exercise, and stress management for a healthy brain, we must also prioritize our oral hygiene. By adopting a proactive approach to oral health, we can create a virtuous cycle that benefits both our mouths and our minds. Good oral hygiene practices can prevent gum disease, reducing inflammation, and lowering the risk of cognitive decline. This, in turn, can contribute to a longer, healthier, and more fulfilling life. It's important to remember that our bodies are interconnected systems. When one part of the system is out of balance, it can have ripple effects throughout the body, including the brain. By taking care of our oral health, we are not just protecting our teeth and gums, but also safeguarding the health of our brains. The connection between oral health and brain health is a powerful reminder that seemingly small choices can have a significant impact on our overall well-being. By adopting simple yet effective oral hygiene practices, we can significantly reduce our risk of developing gum disease and protect our brains from the harmful effects of inflammation. Let's shift our perspective from treatment to prevention, recognizing that investing in our oral health is an investment in our brain health and our future. By prioritizing our oral hygiene, we can age gracefully, maintain our cognitive function, and enjoy a higher quality of life for years to come. Remember, a healthy mouth is a gateway to a healthy body and a healthy mind.